viewers, welcome to my YouTube channel. Kindly like, share and subscribe my YouTube channel for further more informations like this. So today we are going to learn what is the meaning of the endometriosis, the definition, what are the sites where the endometriosis grows and what are its causes, clinical features, what are the pathogenesis theories explained, and then imaging techniques, and then gist of treatment is present in this video. So let us begin the video. So endometriosis is a definition. We'll start it from the definition. Presence of functioning endometrium in the sites other than the uterine mucosa. The simple sentence is presence of functioning endometrium in the sites other than the uterine mucosa is called endometriosis. You can see here in the figure that endometriosis is usually present in the uterine mucosa. This is the normal area of the endometrium. So this endometrium starts to grow other than the uterine mucosa. That is, you can see in the figure, the endometrium, functioning endometrium, is growing over the fallopian tube, over the ovaries, inside the ovaries. These are the other sites than the uterine mucosa, where the endometrium is growing and even functioning. That is, the shedding off of the endometrium takes place. And the sites of endometriosis are abdominal, extra-abdominal, and remote areas. In abdominal, it may occur at any site, but usually confined to the abdominal structures, that is below the umbilicus. Extra-abdominal is usually the scars. The common sites are abdominal scar of hysterectomy, cesarean sections, tubectomy and mammectomy, and episiostomy scar, vagina, and then cervix. What happens in this extra abdominal is the scar. The scar is nothing but the surgical scar present in a woman. That is, we can take an example of a LSCS, cesarean section. After cesarean section, there will be a scar present over the abdomen, uh, and then the lining of the endometrium may be mistakenly displaced or misplaced from that side and develop over that cesarean section. So there may be the chances of growing of that endometrium, that is a functioning endometrium, over that cesarean scar. And we can take it an example of myomectomy. In myomectomy, what is a myomectomy is removing of the myometrium. That is one of the layer, endometrium, myometrium. Myometrium is a layer of the uterus. So in myomectomy, when we remove the myomectomy, there will be some surgical misplacements. Due to that surgical misplacements, there may be the developing functioning of the endometrium uh, in the myomectomy. That is, there may be the functioning development of the endometrium over that scar or that unusual place, we can say. That is usually occurs after the surgery. We can see in episiostomy scar also we can see here. So this extra abdominal growth occurs due to the surgical involvement and maybe directly placed or it may be implanted, we can see here. And then common sites of endometriosis is ovaries, pelvic peritoneum, pouch of Douglas, ureterosacral ligaments, sigmoid colon, appendix, pelvic lymph nodes, fallopian tubes. These are the common sites of endometriosis. And then remote and rare areas, we can even see over the lungs, pleural, and then ureter, kidney, arms, legs. In these places, we can even see the functioning endometrium. So next, the causes are usually unknown, maybe the family history, or many theories are applied over this to know this pathogenesis. As I have said that just now, that about the scars, how the scars causes the endometriosis, that is episiostomy scar, myomectomy, LSCS, how it causes the particular scar, how it causes the functioning endometrium on the other side is one among the pathogenesis. That pathogenesis is a theory in which the direct implantation of the endometriosis occurs by the surgery or by some directly placed. We can consider it during, usually during surgery it happens. And then what are the clinical features of endometriosis is, generally the symptoms are dysmenorrhea. Dysmenorrhea is a painful menstruation and abnormal menstruation. Infertility is also a cause. Dyspnea is a painful coitus. Chronic pelvic pain and abdominal pain are usually present in this uh, as a symptom of endometriosis. And then other symptoms, as we have seen, the remote areas are also present. So if you see the some of the remote areas examples, like in urinary, there may be dysuria, back pain, and then hematuria may be present. Hematuria may be present because the presence of the shedding of the endometrium. Because as there is a functioning of the endometrium, the function of the endometrium is uh, to shed the clot blood, and shedding of the endometrium is a main function of the endometrium. So here the shedding of the endometrium consists of blood, so urine may consist blood in the case of endometriosis. And sigmoid colon and rectum, in that case we can see painful defecation, diarrhea, constipation, rectal bleeding, and melena. Here comes the differential diagnosis. We need to rule out properly in these cases. It may be related to endometriosis or it may be related to the local issues, like rectal bleeding may even happen in the piles, hemorrhoids in that cases, and melena may happen in the peptic ulcers, duodenal ulcers, like that cases. And we need to rule out the exact cause of this. So in the case of lungs, we can see the hemoptysis, ketamine, chest pain. And the imaging techniques, how we can identify the functioning endometrium is through laparoscopy, which is a gold standard method. And then TVS is a transvaginal sonography. It can often detect the ovarian and endometriomas. Ovarian endometriomas is nothing but we can call it as a chocolate cyst. Chocolate cyst is we can consider it as a complication of the endometriosis. Look, when the endometriosis develops in the ovary, there will be a stagnant of the blood over in the ovaries, and that gradually turns into light brown color, and it due to that consistency we call it as a chocolate cyst. So here endometrium, so here endometriosis has a complication of ovarian endometriosis, that ovarian metriomas, that is as a complication of the endometriosis, that is chocolate cyst. So we can detect that even the chocolate cyst is present in case we can think there is a chance of endometriosis. Usually the chocolate cyst occur because of the blood which gets stagnant in the ovaries, that causes the chocolate cyst after a longer period of time. And then magnetic resonance imaging, and then colonoscopy, rectosigmoidoscopy, cystoscopy. Colonoscopy, rectosigmoidoscopy are the other investigations used to rule out the endometrium and functioning endometrium over the colon, sigmoid colon, rectum in the other place, that is remote areas. So now we are going to see the complications. What are the complications is endocrinopathy. There may be imbalance in the hormones, and then rupture of the chocolate cyst. What happens here is rupture of the chocolate cyst is, and infection of the chocolate cyst, malignancy. Here malignancy is rare. Sometimes the endometrium, if in severe cases, it may turn into malignant case. It is not actually, endometriosis is not a neoplastic condition, although it may convert into, there is a chances of converting into malignancy. So the chocolate cyst we have understood, it is a complication of the endometriosis here, because the endometriosis which is growing inside the ovary, it may get stagnated there. The blood which is shedding, it gets stagnated there for a longer period of time. So that stagnated blood slowly gradually turns into light brownish color. Due to that color and consistency, it is considered as chocolate cyst in the ovaries. Next is a simple basic treatment we are going to see in cyst. So here the treatment involves medical therapy, that is hormonal and others, and surgical. In surgical, we are seeing about the conservative and definitive, and combined therapies, medical and surgical. In surgery is conservative and definitive. Conservative is to protect the particular organ. Uh, Definitive is we can think about the uh, removal of the organ, removal of the something, that part. And surgery of conservatives, we need to preserve that particular uh, organ. And combined therapies, medical and surgical. And here hormonal treatment is given is, so expectant management first we are trying to give, that is NSAIDs to relieve the pain as dysmenorrhea is present. And then prostaglandin synthesis inhibitors is given, because of the dysmenorrhea. Prostaglandin synthesis inhibiting is given to manage the pain. And hormonal treatment like pseudo pregnancy OC pills are given in case of endometriosis. What happens in this is, by suppressing the growth of the uterine lining, the pill can reduce the painful growth and similar tissues elsewhere in the body. Pseudo pregnancy OC pills are given here, that is oral contraceptive pills, in which that can reduce the painful growth of the similar tissues elsewhere in the body. This will suppress the uterine lining growth in the other places. And then pseudo menopause is given, that is danazole. What happens if you give danazole is, why we are giving danazole in this condition is to create a high androgens and low estrogen environment, often called as pseudomenopause. That is, when the low estrogens, we are giving an environment such as false menopause has occurred. What happens in the menopause? Uterine lining will be shrunken. Your uterine lining gets atrophied. So, if the uterine lining is atrophied, the symptoms may reduce, and hence we are giving here danazole. If the uterine line is thick, the lining is thinning, then we can give danazole, because functioning of the endometrium causes, functioning of the endometrium in the other sides causes endometriosis. So if we are reducing that lining, there may be the relief from the symptoms. And there may be the reducing by giving the hormonal therapy like danazoles. So we are giving this treatment here. Medical oophorectomy is also given, that is GnRH antagonist, progesterone and antagonist, sorry, GnRH agonist is given, and progesterone antagonist is given. Progesterone antagonist, what happens if we give progesterone antagonist is, that inhibits the growth and survival of the endometric tissue by blocking the effect of the natural progesterone. What happens here is, all this acts in the uterine lining of the endometrium. So when the uterine lining is reduced, then the symptoms may also reduce, and may even be easy to treat. And then in surgical management, we can see, we can give cauterization, that is burning of the endometrial lining. And then laser vaporization we can do. And then cystectomy, cyst wall resection is also done. Cystectomy in this condition is done due to the presence of the chocolate cyst. If you remove the chocolate cyst, there may be the absence of the symptoms of endometriosis. So this was the basic information about the endometriosis. So for the further more information like this informative videos, kindly like, share and subscribe my YouTube channel and support my YouTube channel. Thank you so much.